Hello, everyone, and thanks for joining us for today's webinar. Today's topic is exploring financial barriers and practical issues after a cancer diagnosis. This is a question that's come up in our community often through our social media channels, as well as our direct back and forth with ambassadors. We want to make sure that we're providing all of you out there in the Fight CRC community with some real tangible resources for how to overcome some of these challenges. We brought together a panel today of three people. We have Joanna Morales from Triage Cancer. We have Amy Niles from the Patient Access Network Foundation, and Karen Whaling, who is one of our favorite ambassadors and research advocates here at Fight CRC. So I'd like to talk a little bit at first about how we're going to run today's webinar, because it could be a little different than some of the traditional webinars you may have been used to before. We're going to have these three panelists who are going to present for about 10-15 minutes each on their specific areas of expertise. I would like to ask all of you in attendance to please pose your questions into the Q&A section or into the chat so we can address them as we go throughout this conversation and then in the Q&A session at the very end. We also have this webinar will be added to, and we have many other webinars in our webinar archive. You can watch this future recording or watch other webinars we have at fightcrc.org. And also feel free to tweet along. We'll be doing so. You can follow along on our Twitter and use the hashtag CRCwebinar. Also, I want to introduce you to some of our resources as well, if you don't already know about them. If you go to our website, we have just redone our mega menu. Beautiful new website for you all to have access to. You can check out a lot of the other resources we have on other important topics to the colorectal cancer community. This includes our Wellness Wednesdays that we do on Facebook Live, Your Guide in the Fight, which is our flagship resource for stage 3 and stage 4 colorectal cancer survivors, as well as updates on new publications we have, upcoming events, blogs. We have our Tabooty podcast, so many different resources for you all to see. Please go ahead and check out our website, fightcrc.org, to find out more. Also, just as a general disclaimer, the information and services provided by Fight Colorectal Cancer are for general information purposes only. The information and services are not intended to be substitutes for professional medical advice, diagnoses, or treatment. If you are ill or suspect that you are ill, see a doctor immediately. In an emergency, call 911 or go to the nearest emergency room. And Fight Colorectal Cancer never recommends or endorses any specific physicians, products, or treatments for any condition. Now let's get into the real stars of the show, today's presenters. Starting out will be Joanna Fazio Morales, CEO of Triage Cancer. Joanna, will you please introduce yourself?
Thank you so much. So I am the CEO of Triage Cancer, and I'm also a cancer rights attorney by training. And I've spent the better part of the last 2.5+ decades teaching people how to navigate the legal, practical, and financial issues that come up after a cancer diagnosis. So with that, did you want me to go ahead and start sharing my screen? Or we're going to introduce everyone first?
We'll just do the quick introductions first, and then you'll be the first up. Thank you. All right, our next presenter after Joanna will be Amy Niles, Executive Vice President at Patient Access Network Foundation.
Hi, everyone. This is Amy Niles, and it's so nice to be with all of you today. I've been with the PAN Foundation now for about 8 years, and I have the pleasure of wearing two major hats. One is working with terrific patient advocacy organizations like Fight Colorectal Cancer to really create awareness about the fact that financial assistance is out there for patients. We want to create greater awareness about the resources that are available to all of you. And secondly, I lead PAN's public policy and advocacy program. So at the end of the day, while we're providing support to all of you, we also want to advocate for improved access and affordability to care.
Thank you, Amy. And then we also have Karen Whaling, who is one of our research advocates and survivor of stage 4 colon cancer. Please introduce yourself.
I'm Karen Whaling, as it says. I diagnosed with stage 4 colon cancer 9.5 years ago, and I'm still here. I have been with Fight CRC for over 5 years. I do a lot of volunteering, a lot of advocacy, especially research advocacy, but also patient advocacy, um, and trying to pass on anything I have learned from being a patient and survivor, and passing on to other people who need it. That's pretty much it. And I volunteer primarily with Fight CRC.
Fantastic. Thank you, Karen. All right, so now we will go ahead and hear from Triage Cancer and Joanna. Joanna, I'll stop sharing and you can start sharing your screen.
Okay, so I was asked to talk a little bit about some key tips for navigating health insurance. And I often say that there should be a class in high school on health insurance because it's one of those things that everybody needs mostly in their life, but we never really get taught how to make decisions about health insurance, the coverage. If we're lucky enough when we get our first job, we get handed some paperwork if they offer health insurance and we sign something. And if we have to make choices, we guess about those choices. So we try to provide tips that help people make those really basic decisions. And that includes everything from animated videos on how to pick a plan to more in-depth webinars. And so I'm going to point you to some of the resources that we have available at the end of this, but I want to share some key tips. So in the United States, there's only 3 places where we get our health insurance coverage. We're either getting it directly from an insurance company, we're getting it through the government, and by that I mean Medicare, Medicaid, military and veterans plans, or state or local programs. But still 50% of people in the United States get health insurance coverage through their employer. So there are some key terms we think everybody should understand about their health insurance coverage, regardless of where you get it. And the first is called our premium. It's what we pay typically each month just to have health insurance. If we never got medical care during the year, we'd still have to pay our monthly premium. But then there are costs that we pay when we actually get certain types of health care. So first we pay our annual deductible, which is a fixed dollar amount that we have to pay first before our health insurance coverage even kicks in. And so you might have a $500 deductible, or you could have a $5,000 deductible, depending on your policy. It might even be a $0 deductible. And then there's something called a copayment, and that's a fixed dollar amount that you pay when you get certain types of care. So you might have a $10 copayment to see your doctor, or you might have a $30 copayment to see a specialist, or you might pay a $200 copayment if you walked into the emergency room. And that's different from coinsurance or cost share. And part of the challenge of health insurance is that there's at least 2 names for the same thing for just about everything. So coinsurance and cost share are a percentage. It's the difference between what insurance company pays for our medical expenses and what we pay for our medical expenses. So if you have an 80-20 plan, the insurance company pays 80% and you're responsible for 20%. And then there's something called an out-of-pocket maximum. And this, I think, is the most important thing that people should know about their policy, because in a worst case scenario, it's the most that you're going to pay out of pocket for your medical expenses during the year. And it's a fixed dollar amount. And it's going to depend on your policy. So you might have a $1,000 out-of-pocket maximum, or you could have a $20,000 out-of-pocket maximum, again, depending on your coverage. And so how you reach your out-of-pocket maximum is actually a math problem. So you get to add up what you pay for your deductible, plus any co-payments that you pay during the year, plus any co-insurance amounts that you pay. And then when you reach that out-of-pocket maximum, your insurance will kick in at 100% for the rest of the year. So it's the most that you'll pay out of pocket. So to give you an example of that, Dan has a policy that has a $2,000 deductible. It's an 80-20 plan, and he has an $8,000 out-of-pocket maximum. And he has spent a week in the hospital, and he walks out with a $102,000 hospital bill. So assuming he's had no other medical expenses during the year, how much does he actually have to pay of that $102,000 hospital bill? So first he's going to pay his $2,000 deductible, which leaves $100,000 left of that bill. But he has an 80-20 plan. So the insurance company is going to pay 80% and he's responsible for 20%, which is $20,000. But he has that $8,000 out-of-pocket maximum and he's already paid his $2,000 deductible. So he actually only has to pay another $6,000 of that $20,000 bill for a total of $8,000. And then the insurance will kick in and pick up the rest of that $20,000 bill. Now, I never suggest that $8,000 isn't a lot of money, but it is better than the $20,000 bill he would have been left with if he hadn't had that out-of-pocket maximum, or even the bill that he started out with if he didn't have insurance. So the last two slides are actually something that we include in one of our animated videos called Health Insurance Basics. So if you want to hear that again or think that's useful to somebody else, we have that animated video. Now, there are a couple of key protections and rights that people have in the context of health insurance. And these rights that I'm going to mention come from the Patient Protection and Affordable Care Act, otherwise known as the ACA or Obamacare. And one of the things that the ACA did was change the way that health insurance companies decide how much to charge us for our premiums. And that is called premium rating. So previously, insurance companies could look at whatever they wanted to when pricing a policy. And now they can only look at four things: whether or not you're buying a policy for an individual or family, because if you're covering more people, they can charge you more; where you live based on your zip code; your age, but they put a cap on how much more you can get charged as you get older. There was no cap previously. And then if you use tobacco, you can actually be charged more for your health insurance coverage. Some states actually passed state laws after the ACA that eliminated that. So what's missing from this list? Pre-existing condition and gender, more significantly. So those two things have made a huge impact on the cancer community because women have always been charged more than men for health insurance coverage, and that's no longer allowed. But then the ACA went one step further and said, we're not going to let people be denied health insurance coverage based on their age, their gender, where they live, or really any other reason. If you can afford the policy, they have to give it to you. So these two things together mean that an individual with a cancer diagnosis can't be denied health insurance coverage and can't be charged more because of that cancer diagnosis. So that was totally game-changing for the cancer community in terms of how to access health insurance coverage. But the ACA also did something very useful in the context of appeals. It is pretty frequent where someone is denied coverage for a particular type of service. So whether it be a preventive service or a prescription drug or surgery or certain type of treatment, your insurance company at some point might say no. And you can appeal that decision. And you can do that inside the insurance company through an internal appeal. But if they still say no, you now have the right to go outside the insurance company to what's called an external appeal. And the details are slightly different of how it works in every state, but it is available in every state, where you get an independent entity deciding if the care that you've been prescribed is medically necessary. And if that entity says yes, that's binding on the insurance company. So I often say this is the best kept secret of our healthcare system, because for people who actually go through the external appeals process, on average across the country, they win about 50% of the time, which basically means 50% of the time the insurance company is getting it wrong. This data at the bottom is actually for California, which has the highest rate for people actually being successful through the independent medical review at 60%. So we have the actual information on how to go through this process on our website. But here's why this is the best kept secret. This is data from 2019 that showed there were approximately 40 million claims denied, but only 0.2% were appealed, even through the internal appeals process, which means people are totally taking no for an answer, and they shouldn't. Because if you think about 40 million claims and the average overturn rate is 50%, that means 20 million claims could have been appealed and people would have gotten access to the care that they needed, which to me says 20 million claims were denied and people didn't get access to the care that they needed, or they paid for that care out of pocket where their insurance company should have paid for that care. And that is a terrifying statistic. So it is part of our mission to make sure people understand the appeals process and don't take no for an answer. So insurance companies under the ACA are required to cover the routine costs of clinical trials if they are a private insurance plan. What that means basically is that when someone is going through a clinical trial, there are things that would have been part of standard of care. So things like office visits and blood work and imaging scans. And so those are things that your insurance needs to cover under the ACA and not pass on all those costs to you. So that was a huge benefit to encourage people to participate in clinical trials. About half the states had this protection before the ACA. So in some states, the protection is actually even better. So we have that information on our chart of state laws. But Medicare, TRICARE, and VA plans also have these protections. The newest news available is that just in January was signed into law that Medicaid in every state now has to cover the routine costs of participating in clinical trials. And this is something that the cancer community has been advocating for a long time. So it's exciting that I can now share that with you. So the other exciting news is that the Affordable Care Act created the state health insurance marketplaces, which are effectively a shopping mall for you to go and find private health insurance plans available to you where you live. But there are benefits to those plans, including that there are financial assistance options available to buy those plans. We have a lot of information about the marketplaces on our website, including a quick guide and a webinar. But I am bringing this up here because there is a special enrollment period that is open right now where if you need health insurance or you want to change your marketplace plan, you can do that right now. So the special enrollment period started February 15th and will go until May 15th. So this is a huge benefit to anyone who needs health insurance coverage right now. So I want to give you just a quick exercise on how to pick a health insurance plan so that if you are shopping for insurance, this is a way to compare your plan options. And it's useful if you're comparing marketplace plans, if you're comparing choices that your employer gives you, or you can compare what your employer gives you to what's available in the marketplace. And then if you have Medicare, you can compare your Medicare options the same way. So here are 3 different plans. There is a bronze plan that's $173 a month and has a $6,000 out-of-pocket maximum. There's a silver plan at $271 a month with a $5,200 out-of-pocket maximum, and a platinum level plan at $398 a month with an $1,150 out-of-pocket maximum. So can you tell just by looking at these options how much it's going to cost you by the end of the year, assuming that you're going to hit your out-of-pocket maximum? Because when we're talking about cancer care, the likelihood is you're going to hit your out-of-pocket maximum. So the short answer is you can't tell just by looking at them. You actually have to do the math. And the way that you do the math is that you take the out-of-pocket maximum and you take the monthly premium and you multiply it by 12 because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket maximum because that's the most that you're going to pay out of pocket during the year. So in this example, it turns out that the platinum level plan actually ends up saving you more than $2,000 by the end of the year. Even though we look at that monthly premium and we get sticker shock and we think that's so much more expensive, but it's because most people don't understand how out-of-pocket maximums work, that they're just making decisions based on monthly premiums. And that's where we get those huge out-of-pocket costs. So when we talk about how to minimize financial toxicity, we actually think this is the best way to do it, because if we can minimize out-of-pocket costs, then we can just focus on addressing what's left. and the other issues that can impact someone's financial situation. But it's not just about cost. You also have to make sure that you're picking a plan that actually covers your providers and covers your prescription drugs. Because if you pick a plan that doesn't cover those things, it's pretty useless to you. So you want to check that information. Now, I have gone through a pretty high level overview of some of the things that we think are most important for navigating insurance, but we have a huge number of resources that not only cover health insurance in terms of what your options are and how to use health insurance, but many other topics as well. So we have all of those resources available for free on our website at triagecancer.org. And we also have free educational events. So we have monthly webinars, and we have our Triage Cancer Conference, which is a full day of things like insurance and finances and work and other practical things for planning ahead. I mentioned our animated video series. We now have quite a few topics on the things we think are most important for people to know about. And most of this information is relevant to everybody. We just talk about it in the context of a cancer diagnosis. So feel free to share these with anyone who you think might benefit from the information. And then we also host a resource called cancerfinances.org, where you can go on to this section of our website and pick a topic and then start to answer questions based on your situation. And it will tailor the content to you based on how you've answered those questions so that you get the information that's most relevant to you. It's also where we share financial assistance resources that we are aware of in the cancer community, like Pan Foundation. So this is where we are pointing people towards additional financial resources that are out there. So with that, I will stop sharing my screen and turn it back over.
Thank you so much, Joanna. Really appreciate it. Lots of really good information in there. It's certainly going to be very valuable to all of us here on this webinar and for those that get to view this later. I just want to remind everybody, be sure if you have any questions or anything like that to go ahead and put that either in the chat or in the Q&A tab located at the bottom of your Zoom window. Thank you. All right, next we're going to hear from Pan Foundation. So just give me a moment to pull up those slides, and then Amy, it'll be all set for you.
Great. Well, thank you, Mike, and thank you to Fight CRC for inviting me to speak today. It's an honor to be beside Joanna and Karen as well. Thank you all for spending a little bit of your day with us. If we can go to the next slide. In the time that we have together, I'd like to introduce the Patient Access Network Foundation to you, or commonly referred to as the PAN Foundation. Importantly, I want to walk you through how you can go about finding financial assistance for colorectal cancer or other diseases and conditions you might be living with, or perhaps someone near to you and dear to you, they might need assistance as well. And finally, we'll touch on the importance of advocating for lower out-of-pocket costs. So I think we'll go to the next slide and maybe the one after that. So at the Patient Access Network Foundation, we are very concerned about the rising out-of-pocket costs for prescription medications. I know that some of you may have already gone through this or are going through this now, but imagine being diagnosed with colorectal cancer. You're prescribed a specialty medicine that's expensive, and now you're faced with hundreds, if not thousands of dollars in out-of-pocket costs. How do you afford that treatment? Here are some startling facts that I want to share with you. Last year, the PAN Foundation surveyed 8,000 patients. And what we heard from them, 3 out of 4 told us that they were not able to afford their treatment. At least 1 out of 3 indicated that they had to delay their treatment or stop taking their medications because they simply could not afford it. And sadly, 1/2 told us that they had to reduce the amount of food on their kitchen tables to be able to afford their treatment. So these are very sad statistics. We know today that 14 million Americans are paying more than $250 every single month just in out-of-pocket costs for prescription medications. So if you're diagnosed with cancer or another life-threatening chronic and rare disease, you may find yourself spending $5,000 or $10,000 or more in out-of-pocket costs over a 12-month period. This is extraordinarily challenging. If you're a senior on Medicare, it is extremely challenging. The average income of a Medicare beneficiary, someone who is disabled or over 65 years of age today, is $26,000 per year. And unfortunately, Medicare beneficiaries cannot seek financial assistance for their prescription medications directly from pharmaceutical companies. So this is where charities like the PAN Foundation come in. We are one of 9 patient assistance programs here to provide financial assistance to cover out-of-pocket costs for prescription medications. We're focused on the people who are underinsured, living with life-threatening chronic and rare diseases, and we're also here to advocate for improved access and affordability. Next slide. So we've been around now for about 16 years. Over that time, we have helped more than 1 million people access the treatment they need. We're very proud of that, but we know that many, many more are in need of support. Today, we operate about 70 different disease financial assistance programs. They cover oncology, chronic illnesses, and rare diseases. Of the 70, about 20 or so are supporting individuals who are living with cancer. One of them, of course, is for individuals diagnosed with colorectal cancer. Through our programs, we're able to give grants that cover most, if not all, of one's out-of-pocket costs for prescription medications over a 12-month period. And you just heard from Joanna that you heard the terminology of copays and coinsurance and deductibles. These are exactly the costs that we are covering when we refer to out-of-pocket costs for prescription medications. All of our assistance programs are listed on our website, which is panfoundation.org. In addition, the eligibility criteria for each of these programs is listed, as well as the formularies that we provide. A formulary is a list of medications that we cover in each of our programs. And for all of the 70 programs, our formularies are broad. All FDA-approved brand and generic medications are covered in the programs. Next slide. So we make it very easy for patients, their care partners, or family members to apply for financial assistance. You'll want to start at panapply.org, and you'll be asked for the following information, the information that you see here on the slide. Basic information about yourself, your diagnosis, medication that you have been prescribed, your insurance information, income, number of people in household, and your physician or facility contact information. Literally in a matter of minutes, you will know if you are approved for a grant, and you'll receive your PAN ID, and that ID can be taken immediately to the pharmacy counter. We have worked hard to remove all kinds of barriers. So we don't want to ask for a whole bunch of information. We don't want the process to be cumbersome. We want it to be quick so that you can get to the pharmacy counter to start your treatment. Next slide. So one of the things that we hear often from folks is frustration when funds are closed. It is not uncommon at the PAN Foundation or the other independent patient assistance programs for our assistance programs to open and close many times during the course of the year. It simply means when a program is closed that we have run out of money, hopefully temporarily, and that program will open up soon. So unfortunately, today, our colorectal cancer fund is closed. We hope it will open up soon, however. It's frustrating for patients and caregivers, even healthcare providers. But the important thing to know is that even if you are looking for assistance and that particular program is closed, you should put your name on our wait list, because as soon as that fund reopens, we will be in touch with you. Next slide. So let's now turn to the program I'm sure all of you are most interested in, and that is our colorectal cancer fund. To be eligible for assistance, one needs to be treated for colorectal cancer. One must have Medicare insurance. So your claims for assistance will be submitted first to Medicare, and PAN will come in really as a secondary insurer. And you have to have income at or below 400% of the federal poverty level. I know that people are often confused about federal poverty level and what that means. So as an example, if you are a family of two and your income is about at $70,000 per year or less, that translates to about 400% of the federal poverty level, and you may be eligible for the program. And if eligible, you can receive assistance at $2,400 per year. Next slide. Another key area of focus for PAN is transportation. We know that if a patient can't physically get to their healthcare provider visit, they may not even be able to pick up a prescription. And we know if they can't get to the pharmacy, they may not even be able to fill that prescription. So we want to remove all kinds of barriers so that patients can start and stay on treatment. And that's why a couple of months ago, we launched a transportation assistance program for our Medicare patients who are enrolled in our program. And with this program, one receives $500 per year, and that can be applied to a range of different kinds of costs that you might incur, from public transportation to taxis to parking. And we know this has been a real service to many, many patients so far. You can enroll in this program, or a caregiver can enroll in this program also through our website or by starting at panapply.org. Another program that I wanted to mention that I don't have a slide for is our COVID financial assistance program. We know it's been a very challenging year, and many people are finding themselves in financial hardship. So when the pandemic started, we began this program, and we offered a $300 debit card that really could be used in any way that you find that you need to use it. It is for our Medicare beneficiaries, it is for people who are living with cancer or other chronic conditions who have been affected by COVID. And again, you can use it for out-of-pocket costs, or it can be used even for transportation or to put food on your table. And when we look at the thousands of people who have already used the card, sadly, they're using it to put food on their table. So let's go to the next slide. It's actually two more slides, how to find assistance. So the process of finding financial assistance is very stressful for patients, for caregivers, for family members, even for healthcare providers. I mentioned earlier that we are one of 9 national patient assistance programs, mostly serving the Medicare population, but not exclusively. Collectively, we operate 200 plus programs. So many of you may have already experienced this, but can you imagine trying to check in with multiple organizations, perhaps even every single day, to see if financial assistance is available? The process is exhausting. And that's why about 2 years ago, the PAN Foundation launched a program called Fund Finder. Through a web app, we're able to track the available fund status of these 200 plus programs in one convenient place. We update this information every single hour. Anyone can sign up for Fund Finder. It's absolutely free, and you can do so at fundfinder.org. Once you're signed up, you can receive email alerts or text alerts when a program opens. So let me use an example with colorectal cancer. If you look on Fund Finder, you will find today that there are 5 foundations who provide copay assistance for colorectal cancer. I'm embarrassed to say, or it's sad to say, that all of these programs today are closed. None of them have available funding. We're all working hard to make sure that we can replenish our funds as quickly as possible. So let's say tomorrow, a foundation, it could be Pan Foundation, it could be Good Days or Healthwell, another foundation opens up. If you were registered with FundFinder, tomorrow you would receive that alert by email or text that that program has opened up, and it would prompt you to immediately call them or go to their website to start the application process. So it is a terrific program, and we know that it has saved a whole lot of time for tens of thousands of patients. Next slide. I'd like to talk to you about another very important program for our Medicare beneficiaries. And this is a federal program called Extra Help, or the Low Income Subsidy Program. If eligible for this program, you can save 85% or more on out-of-pocket costs. This program targets individuals who are living at very low income, 150% or less of federal poverty level. Unfortunately, far too many seniors, caregivers, even healthcare providers are aware that this program exists. So we are doing all we can at PAN and on our website at panfoundation.org/extra help to let people know about this terrific program. A lot of great information, a great video, and even an eligibility checker to see if you might be qualified for this program, and also sharing the next steps that you might take if you are eligible. Next slide, please. So we are humbled to be able to help so many patients with their out-of-pocket costs. You know, every year we're helping about 150,000 people. The last thing we want to see is someone walk away from the pharmacy counter without being able to fill their prescription. The last thing we want to see is someone having to make these unfortunate trade-offs and have to choose between their mortgage, rent, food, or their medications. So at the end of the day, I think collectively, we all need to advocate to lower out-of-pocket costs. There are legislative solutions, such as the ones that you see on this slide, that would really go a long way in helping so many of our Medicare beneficiaries. And I'd just like to touch on the first two for a moment. The first strategy that we think would be a big improvement is placing an annual cap on out-of-pocket costs for prescription medications. You heard earlier from Joanna that often plans have a cap on what you spend out of pocket. But unfortunately for Medicare beneficiaries, when it comes to prescription medications, there is no cap. And so placing a cap would place a limit on what you pay over a 12-month period. The second strategy that we think is very important is a concept known as smoothing. And I liken it to how energy companies often work with their customers to spread out your energy costs from one month to the next. So if you're a Medicare beneficiary, you may already know that come January, it is a very difficult month for you. Deductibles reset, and you may be faced with hundreds, if not thousands of dollars in January alone. So this kind of smoothing policy solution would spread these costs out January through December evenly, and it would provide a whole lot more predictability to our seniors. So next slide, what can you do? We want members of Congress to hear directly from you. We want them to hear about the burden of out-of-pocket costs, and we want them to hear how it's affecting your health, your quality of life, and health outcomes. And so we've made it easy for you to do this at panfoundation.org/right-congress. Simply by putting in your name and address, you'll see who your members of Congress are, and we have a template email that can be sent very quickly to your members of Congress relating to the Part D cap and smoothing. You can customize the letter as well, and literally with a click of a button, off goes your communication to your members of Congress. And next slide. So I want to thank you for joining the program today. I know that affording treatment is a critical issue for millions of Americans. And on top of that, this has been a really challenging year with the pandemic. I encourage all of you to reach out to the PAN Foundation, but also to reach out to terrific organizations like Triage Cancer and Fight CRC. We are here to help you. Our website is panfoundation.org. Our portal is available to you 24/7, but if you would like to speak to someone about applying for assistance, you may do so by calling 866-316-7263. Our call center representatives are available Monday through Friday, 9 a.m. to 7 p.m. Eastern Standard Time. Thanks so much.
Thank you very much, Amy. That was great. We had one question coming in while you were giving your presentation, asking about if I pull it up here, asking if you assist undocumented patients.
The eligibility requirements for each of our programs are listed on our website. The only thing that we ask is whether you reside in the United States. If you say yes, you meet that eligibility requirements. Of course, you have to meet the other eligibility requirements that relate to income and insurance. But in terms of residence, we simply ask that you reside in the United States and receiving treatment in the United States.
Okay, great. Thank you so much. All right, and remember, if anyone else has any other questions, please just drop them in the Q&A and we'll be sure to get to them. All right, thanks. Now we'll have Karen tell us a little bit about her story and how finances have impacted her survivorship journey. Karen. Oh, I think you're muted, Karen.
Better?
Better, thank you.
I've been taking notes furiously on all of these presentations. They've been outstanding. Along with myself and my treatment, I'm also an advocate and I talk to a lot of patients. So it's good to have more information that I can pass on. I am a research advocate with Fight CRC, among other things, and that I do volunteer for cancer. I'll tell you a little bit about my journey and things that would have helped me or that I've learned from others, just a few little details. And then I also am involved with clinical trials. And so I'm going to talk a little bit about what you can do as far as clinical trials, what you need to know financially that might be helpful. So my journey started 10 years ago when I was diagnosed with stage 4 colorectal cancer at the age of 54. And that was 4 months after my husband had unexpectedly died at the age of 56 from the side effects of treatment for head and neck cancer. I was trained as a physical therapist, and during treatment, I was unable to work because of the side effects of the treatment. Following the end of my treatment, I have not been able to go back to work because of different side effects. One thing I want to say is, from my experience, every person's story is different. And everybody has needs of different kinds. And, you know, they talk about personalized treatment, personalized care. Same thing is true when it comes to finances. I have found out. In my particular case, I was treated for over a year. I had chemo, radiation, more chemo. I was in a clinical trial. And after a year, a little over a year, I had surgery to remove all of the cancer. I had a temporary ileostomy, and then 10 weeks later, it was taken and reversed. So that's the length of my treatment. It was really, I was quite lucky, especially being stage 4, that was all the treatment I have needed for cancer. Let's see. I was fortunate to be able to pay for my treatment because this is the sad and the silver lining. My husband had passed away, so I had life insurance, and that paid for everything. And it took everything. So you never know what circumstances are going to be. So that's why I'm furiously writing those notes today. One thing that I would do differently as far as my treatment and finances is I would have contacted the social worker as soon as I started treatment. I have doctors that I say walk on water, but they just don't see all aspects of your treatment. And so it wasn't until over a year when I was finished with my treatment that I actually talked to a social worker. If I had done that, I would have found out that being stage 4 colorectal cancer at that time, I would have qualified for Social Security disability, and it would have kicked in within a few weeks. I had the other aspect relating to finances is that I had statistically, they didn't tell me this, but I found out later, 5% chance of living 5 years. And I knew that there was a good chance I wouldn't be around too long. And now that it's 10 years and I had all of these different issues, I am pretty much living on a fixed income, Social Security, and a little bit of an 401k. But I'm not that far from the poverty line. But you learn to be creative. And I don't know if they knew they were going to have me around for so long, but my daughter and her family and I bought a house together. And that was our way to solve the problem. So my advice is be sure to think out of the box, be sure to get lots of help, and be sure to ask lots of questions. They tell you to do that for treatments and for getting your different tests, but be sure to do that for the finances too. As Joanna said, you need to know what your insurance will pay for. You need to know what the costs are going to be, because they are substantial. One of my first thoughts when I was diagnosed with cancer was, thank goodness my kids are grown and they're on their own and I don't have to worry about them. They'll be okay. They may not think so, but they will be fine. But there are so many people that are young in their 30s and 40s that get this cancers, and they have many more financial problems. So that whole idea of knowing what your insurance will pay for is critical, I think, for sure, and your workplace. This past December, I had a colonoscopy that was abnormal, and for 2 days, they thought maybe my cancer had returned, even though it's been 10 years. And it turned out it hadn't. I have other issues, but it turned out I hadn't. But you never know if it's going to come back or not. And it's something that patients are always thinking of, I think. Maybe less as you get farther and farther out, but you're still always concerned about it. So that's why having this information and knowing where to find it is really good. Amy and Joanne had great information. So that's my story. If anybody wants more details, they can contact me. I was asked to talk a little bit about clinical trials. I was in a clinical trial for several months. And then I also now am what they call a non-scientific person, member of several panels of IRB. And IRB stands for Institutional Review Board. You have to go through the review board in order to start a clinical trial. So what we do is we look at the clinical trials and we try to decide, is it ethical? Do the benefits outweigh the risks? And my job as a non-scientific person in particular is to look at the consent form. I need to make sure it's understandable and it has all the information the patient needs in order to be in the trial. Basically, there are several things regarding finances that you look at when you are going through a clinical trial. The consent forms can be 10 pages, they can be 35 pages. So it can be overwhelming, but when it comes to finances, it's really important. What I think it Joanna was saying about the standard of care versus experimental. I didn't even know that about standard of care has to be paid, but you do need to know and be clear, and again, ask questions. And if you have somebody that can help you through all this, make sure you avail yourself of them, because it's a lot to deal with while you are going through treatment. So if you know that, as Joanna said, standard of care should be covered. Experimental usually is not covered by insurance. So then you need to look and find out who is sponsoring this study. If there is a medication, are they the ones who make this medication? And do they provide the medication? That's often the case, but you need to know. What else? You need to know, will I have to pay for anything? There's a section that actually says that. Usually there's very little you have to pay for if your insurance will pay for the standard of care. And then there's a section that asks, will I be paid to be in this study? Which most of the time is no, but sometimes it's yes. And more importantly, sometimes the study will pay for lodging and transportation. A lot of people I know go out of town and have clinical trials, are involved in clinical trials in other cities and states. So that may help them to be involved. And the last thing, finance-wise, is there is a section about what will happen if I am injured in the trial. Some will say that we will help you get care. Some consent forms will also say we will treat you. Very few say they will treat you, pay for the treatment. So you need to know what that involves. They pretty much usually expect the insurance or yourself to pay for that. So you want to know ahead of time. Again, my biggest thing on all of this is ask lots of questions and ask a lot of people, and you'll get more information. And that's pretty much all I have to say.
Thanks so much, Karen. And certainly, again, one more time, take her advice. If you have any questions, this is a great time to ask it. We have a few minutes left. So while you're typing in any other questions you have before we wrap up, I just want to reiterate the importance and the value and the gratitude that we have for all of our presenters today, and really understanding not only the resources that are out there, but helping to understand what the real patient perspective is on these things and what we really need to make sure that you all out there who are both medical professionals helping patients and patients out there themselves are able to advocate for these things. I also heard throughout this that there are opportunities sometimes to help advocate and increase the amount of funding that exists in some of these realms to get involved with different organizations like Fight CRC, Triage Cancer, and PAN Foundation. And I strongly encourage that you do so, because it takes amazing people like yourselves putting yourselves out there and receiving the support, as well as engaging in this support to help make all this happen. So thank you also to all of you out there doing the work, putting in the advocacy, and doing what it takes to help get these programs off the ground and help them continue to help the millions of colorectal cancer survivors out there. So thank you all very much for that as well. I'm going to leave the last word to all of our speakers, as well as I keep an eye out on that Q&A for any more that come in. So if we could just go round robin one more time and see if there's any final thoughts or things to add. Joanna, why don't you start us out?
I will just say that there are so many resources out there available to help you through so many different issues that you might be experiencing. And you should never feel discouraged in asking for help, because that's what we're all here for, is to help you. And so you should definitely pursue those resources. And at Triage Cancer, I talked about health insurance today, but if you have questions about employment issues or disability benefits or estate planning issues or other broader financial issues like managing medical bills, there is a ton of education on our website and connection to other valuable resources in the cancer community.
And I'll just add on to what Joanna said. I agree, there are many financial assistance resources out there, especially when it comes to prescription medications. So for the Medicare beneficiaries, the 9 national patient assistance programs, including PAN, those are a great place to start. So I encourage all of you to spend a little bit of time at panfoundation.org to review the 70 different programs that we have. We're continually adding new programs as well, and really encourage you to register for fundfinder.org. It may save you a whole bunch of time. You know, we don't want people not to fill their prescription. We don't want people making these unfortunate trade-offs. Financial toxicity is real. We really would prefer that you not spend your time looking so much for financial assistance or worrying about financial assistance. What we want you to spend your time on is your health and getting better. So thank you again for being with us today.
And I guess I'll just finish off with a patient perspective. When you get cancer, it can be so overwhelming. Just getting to treatments and just getting out of bed some days is tough. But then when you think about these extra things, like I have all these medications I have to pay for, I don't have the funds, then it goes out and out and out. So my biggest 2 things I would say, as someone who's gone through it and who's helped multiple dozens of people go through it, is make sure that you have somebody that can help you if you do, and ask questions of everybody, and you'll get steered. One person can give you the right answer, but not unless you ask them the questions. There's a lot of groups out here, as you can see from the 2 we've just heard from today. And being a strong proponent of Fight CRC, they are very helpful and willing to help you with anything that you need for colorectal cancer. So thank you.
Fantastic. Well, that brings us to the end of today's webinar. Thanks once again to our speakers, and thanks to our sponsors for this webinar from Fight CRC, No Shave November, and Genentech. Thank you all so much. I hope you have a wonderful day, and we'll see you again next time.